Oh, it's turned afternoon. Good afternoon, everyone. Madam Vice Chancellor and Chairperson, may I stand on existing established protocols as I proceed with my few words? I shall try and make it few because I know everyone is waiting to go and celebrate. I want to thank the Dean, Professor Edwin, and the Council for this invitation to address your students. And I'm very honored about it, and don't take this lightly at all. Thank you for the introduction. I don't share my profile to boast, but I share it to encourage others that if I have been able to get this far, by God's grace, you can get even further. This white coat ceremony has been very impressive. And as has been said by previous speakers, it marks a transition for students from the preclinical studies to the clinical program. And the clinical program is where you actually meet and interact with patients for the first time. And you have to then use the principles that you have learned in the first 2 or 3 years. And these then become real. You've got your stethoscope, which is your tool of trade. You've got your BNF, which will help you write the right doses. And we know how important dosage is. This period from now on then becomes more practical, and it requires a lot more committed work from you. So you have to be ready to work even harder than your preclinical years. It was interesting to hear you remind yourselves of all the things that you went through from level 100 to where you are right now. You must stay focused and determined. Integrity is the key to the great professional. Be truthful in your documentation of your learning during this period, in your logbooks. Remember that if you have not documented it, no matter what claims you make, you have not done it. And you should not be forging your faculty signatures when you think they are difficult to find. Now, you learn most at the bedside applying the principles that you have learned in the preclinical years. So the wards are where you are going to learn the real medicine. Spend your time there. And wherever else you are required by your faculty as determined in your logbooks. From that time on, not so much time in the books. The books are after you have done the practicals in wherever setting you are. By the time those of you for the MB-CHB would have qualified, the Medical and Dental Council would have instituted the compulsory licensure examination from 2025 for medical doctors, where you and all graduating doctors, no matter where they trained, will have to take this exam before being placed on the Medical and Dental Council registers. Now, this will mean a double whammy of examinations after your final exam in the university. I know the pharmacists have a similar pathway also. But remember that every experience you go through is a learning opportunity. There's something to learn every time that you can use later. Now, the time to make mistakes is at this learning phase. Believe me, it will be 100 times worse when you are made to look foolish, or when you look foolish in front of everyone, especially your patients, when you have qualified. So look foolish in front of a few people and your faculty now, so that you will learn and not repeat your mistakes, because you will be corrected. In Ghana, it seems we have a disease where we are very fond of identifying problems. And then we complain and we complain and we complain. But try and make every problem or see every problem as a solution waiting to be found. So it becomes a challenge for you. And when you do that, you'll find that you become innovative, thinking, and entrepreneurial. Every problem is a challenge and a solution waiting to be found. Remember that what is right, and what is wrong can never be right. Truth-telling, integrity will always pay a great dividend. These were lessons that I learned very early on. And the most critical one was never compromise on doing the wrong thing. It will catch up with you. Integrity in the health profession is key. Always doing the right thing, whether people are watching you or not. Remembering that though man may not see you, God does, and he ultimately will be the judge and the rewarder of everybody. Having your own set of values will see you through your professional life, and that is crucial. Hopefully, these will be the same values that you will espouse as personal values. Your professional values should not be different. Just like some people wait till Sunday, they go to church, and as soon as they close the door from church, they revert to being something else. That should not be so. Your professional life should be comparable with your personal life. Because what you're aiming to do is to build your personal brand. As you progress in the profession, whichever area you are in, what do you want to be remembered for? In Ghana, when we talk about key soap, what do people remember? Maybe some of those who were in my generation, what do you remember? The tradition goes on and on. That is their brand. They've built it. They've shown excellence. They've shown durability. So, quality, durability, excellent results. Because their motto suggests it. The tradition goes on and on. So, when your names are mentioned, what is the slogan people are going to remember? Will it be, oh, that hard-working doctor and student? Or will it be, oh, that lazy so-and-so? They're always making excuses and they don't know how to do anything. The choice is yours. Start building your brand from today, going forwards. And make sure that the values of integrity, passion, commitment, and excellence will always be attached to your name. I was embarrassed when your Vice Chancellor mentioned those. I hadn't really thought about them. But those have been my personal values, and I'm not ashamed to own up to them. Be known for being just and not discriminatory in terms of social status or financial means of education or anything else. That will make people feel inferior when they're in your presence, or that will discriminate to make people feel more superior. Keep adding value to yourselves. I'm so glad to hear that so many of you have things outside of the healthcare profession. That's adding value to yourself. So when people are looking for models or looking for examples or looking for people to give opportunities to, your name will be the one that will come to their mind. And you can do this through educating yourself broadly, not just in medicine or in pharmacy. At the Accra College of Medicine, our core values are what I mentioned earlier, and those we have lived by. And at the center of our core values, we have something we call heart power. It embodies compassion, empathy, willingness to go the extra mile for others, irrespective of where they come from. Never look down on anyone. What you have now is a blessing. Don't take it for granted, because conditions can change in a matter of seconds, and roles can be reversed in a matter of seconds. So somebody you were nasty to is your junior. The next minute you have moved on and they become your senior. And what then happens? Don't worry about getting praise of people. That will follow. The awards will follow. Treat everyone you meet equally with dignity and respect. Can you imagine all the blessings your patients will pronounce on you every day when they remember what you did for them, how you made them feel, as opposed to the curses when you disrespect or maltreat anyone? The other thing I want to remind you is that time doesn't wait for any man or any woman. And procrastination is truly the thief of time. Avoid it like the plague. Don't put off till tomorrow what you can do today, because none of us has tomorrow. We only have today for sure. Until tomorrow arrives as today, you don't have it. So you cannot count on it. And don't be like most Ghanaians, being on time, and be known for being on time. In Ghana, the term Ghana time is a cop-out or an excuse. Don't buy it. We are Greenwich Mean Time, GMT, because the meridian which bisects time zones passes right through Tema. Let us recognize and stick to it. When you are punctual and you are on time, you are showing respect for other people. So whatever you have to do, make sure you are there on time and be the one to wait for others. Then love your country. Don't be in a hurry to abandon it and go and develop another country. We are the only ones who can develop our own country. You are the future. Dream the dreams and follow God's lead to make this country what you want it to be. Speak up for the voiceless and educate and teach at every opportunity, because ignorance can kill and does kill. Your conversation with everyone should be full of grace. Your work should be attractive to everyone. Let what they say about you be positive. By all means, some will say negative things, but let the positive side, that you have integrity, even if it's described as you being hard, be hard. Later, be disciplinarian. Later, they will come and thank you for showing them that direction. Thank God you will not bend. Thank God none of you is going to take any money that you cannot provide a receipt for. Thank God you will not divert patients to your private clinic or pharmacy from the public facility. In my experience, if you go chasing money, it runs away from you. But if you seek excellence in everything you do, you are leading, you are innovating, you are applying appropriate technology, even in this resource-poor environment, money will come chasing you so much that you and your descendants will never be in want. And I'm not joking. Think about this. I know that when you started in level 100, you could not wait for this time when you go to the clinics and so on. Don't get impatient or get tired and weary and stop attending because you think no one is watching. Remember, God is always watching. It will require more commitment from you in this phase if you're going to be able to learn and do things properly. Your theme is speaking to entrepreneurial excellence in healthcare. So your aim should be to contribute to improving specific world targets for practitioner to patient ratios in Ghana. Keep your eye focused on that aspiration. Imbibe all the knowledge and develop the mindset of not waiting for government to provide a job for you once you are past the regulatory requirements. Look at how you yourselves can come together in group practices and provide employment for yourselves. I'm about to finish, but I want to mention my newest mentee, Maoko Afeti. Where are you? Congratulations. He sought me out, and he's been corresponding with me. Well done. I hope some of what I have said today will stay with all of you, and you remember it as you go forwards. May God be your guide. Thank you, Madam Chair.